Researchers have found further evidence that exercise during pregnancy is good not only for mothers but also for their offspring. In research presented at the Virtual European Respiratory Society International Congress, the researchers said that a study of 814 babies had, for the first time, shown a link between lower lung function in babies born to physically inactive mothers compared to those born to active mothers. Previous studies have shown that individuals with low lung functions in infancy have higher risk of asthma, other obstructive lung diseases, and lower lung function later in life. Therefore, exploring factors that can be associated with lung function in infants is important. If being physically active during pregnancy could reduce the risk of impaired infant lung function, it would be a simple, low-cost way to improve the respiratory health of offspring. The researchers say that in their study they found that babies born to inactive mothers were more likely to be in the group with the lowest lung function compared to babies born to active mothers. The researchers asked the women to complete questionnaires at around 18 and 34 weeks of pregnancy about their health, lifestyle, socioeconomic factors, and nutrition. The women reported how often they exercised, for how long and what intensity at 18 weeks, and then were classified as inactive, fairly active, or very active. Lung function measurements were performed when the babies were about 3 months old and was assessed by measuring normal breathing in calm, awake infants. This was done by holding a face mask over the baby's nose and mouth, recording the flow and volume of air breathed in and out. The mask was attached to measuring equipment and as many breaths as possible were recorded. The researchers will be following the babies as they grow to see how lung function progresses and how it relates to development of respiratory diseases such as asthma.